Okay, this is from John McDougall, the doctor who fought for you, by me, Pete Rogers, available at Amazon.com. Here is the part 6 on Dr. McDougall on heart disease. You also can get everything in blue is one of Dr. McDougall's newsletters or one of his videos. Okay, so the epidemiology is very powerful. You'll hear the paleo, keto, carb, low carb nonsense. People try to say, oh, epidemiology doesn't matter. The reason they say that is because it's so obvious that, low-fat, plant-based is the way to go. So here's Dr. McDougall speaking from newsletter October 2007, How to Keep Your Arteries Clean and Reverse Atherosclerosis. There are entire populations who before World War II did not have heart disease. If a whole population could avoid heart disease, then it's unlikely that a person has a genetic problem that's going to make them get heart disease. When a person has atrial fibrillation, their cardiac function is typically decreased by about 25%. The CHAD score is used to determine whether an AFib patient needs anticoagulation. Okay, so that's a big statement there. If you look at epidemiology, you can look at the rationing studies also. When they didn't allow patients to eat meat, they had a dramatic reduction in their coronary artery disease and their diabetes and their hypertension. Okay, those are the rationing studies of World War I and World War II. So they're pretty powerful, that information. And then you can also just look at the Yanomamo, no atherosclerosis. They eat a plant-based diet in South America. You look at the Tarahumara, northern Mexico. They don't get coronary artery disease. Okay, it's just low-fat plant-based diets. You don't get it. Like Carl Esselstyn said, you're not going to grow atherosclerosis from eating kale. Okay, next one, newsletter from April 2013. Does olive oil and eating nuts really... What's their effect on heart disease? So Dr. McDougall says, all stretched out, humans have about 60,000 miles of blood vessel. By the way, a stent is only like, let's say, an inch and a half or something at the most. So you can't stent your blood vessels. You can't stent your way out of atherosclerosis. You've got about 60,000 miles of blood vessels. Your diet affects every inch of these blood vessels. Changing to a plant-based, starch-based diet helps improve blood flow. Over the months, actual healing of the arterial disease, reversal of atherosclerosis, can be demonstrated in almost all patients who eat a low-fat, starch-based diet. That's a big statement. Almost all patients who eat a low-fat, starch-based diet, you can measure a decrease in atherosclerosis per Dr. McDougall. Okay, that's from, next is newsletter April 2013. His next one is from November 2009. He says, he describes multiple papers showing that any benefits of the Mediterranean diet are likely in spite of olive oil and added nuts, not because of them. And Dr. McDougall had spoken up that the nut industry heavily funded the nut studies that make nuts look so good with the Seventh-day Adventists, for example. They're bogus, okay? Jeff Nelson has a whole bunch of videos about the problems with nuts. And that's a very common thing, because you'll hear people say, well, the preponderance of evidence says nuts are good, omega-3s are good, or whatever, olive oil is good. But I don't take that too seriously, preponderance of evidence, because the food company that makes each of these products, they will buy the journals, buy the scientists, and they'll just publish 10, 20, 30, whatever amount of papers they think is necessary. They'll just publish the papers. And then they can say, well, the majority of studies say our product is good. But that's not really science. That's advertising. Okay? And Dr. McDougall would say, nuts come in a hard shell for a reason. Dr. Esselstyn would say, people get addicted to nuts. They taste very good, and they eat too many of them. Okay, this is just a couple more of Dr. McDougall's references. So Dr. McDougall, he was great at arguing and debating the common causes of chronic disease and death in Western populations. So one of the most valuable things you get when you read Dr. McDougall is you'll get all these references, and he's gone through them all. He has the best references. He has them in perfect order. So here's just 4 papers on statins. Statins fail to save lives. Who should take statins? Talks about what a minimal benefit, if any, there is from statins. Crestor expands the indications for statins, and the public suffers. Statin therapy side effects include falls, muscle weakness, etc. Okay, so here's 4 papers showing you problems with statin. And again, I can tell you the smart thing to do is fix as much as you can by optimizing your diet and your lifestyle and avoiding toxins. And then, if you still need pills, take your pills. But work with your doctor to get your doses right and everything, but I'm just saying, isn't it nice to be able to fix a problem just with diet? That's what a real cure is all about. Okay, newsletter July 2012, fish oils fail to prevent heart disease. Yeah, fish oils are very overrated. McDougall would say just eat your low-fat plant foods and you'll get plenty of fish oils. I talked about this in previous lectures, though, that, like Nathan Pritikin would write about populations being fed less than 1% dietary fats, and they did quite well with that. And those were predominantly omega-6s, not omega-3s. Okay, Dr. McDougall newsletter, January 2007, about how long to take Plavix and aspirin after a DES, drug-eluting stent in the coronaries. Here's one that shows that Plavix fails heart patients and causes bleeding. He was concerned about bleeding, especially if you combine Plavix with aspirin, and all these newsletters addressed that fact. Here's one in May 2016, Dr. McDougall newsletter, beware of interventional cardiologists and heart surgeons. Okay, an article about taming elevated triglycerides, insulin resistance, and syndrome X. Syndrome X can be, he could be talking about metabolic syndrome. He could also be talking about coronary artery syndrome X, microvascular angina, and how you want to fix your diet, because otherwise, even if you're epicardial, your big outer coronaries are all open, it doesn't mean, the other ones aren't going to have problems. Okay, here's a paper. The higher the blood cholesterol, the higher the risk of myocardial infarction. Okay, and that concludes the 6 parts of Dr. McDougall on heart disease.